Hello, this is Marla Dalton, Executive Director and CEO of the National Foundation for Infectious Diseases, or NFID. Welcome to Contagious Chronicles by NFID, featuring insights from trusted experts on the latest developments in infectious disease prevention and treatment. A recent report from the Centers for Disease Control and Prevention, CDC, found that vaccination prevented hundreds of millions of illnesses and more than 1 million deaths in U.S. children over the past 30 years. Yet recent surveys have found that some parents still remain hesitant about vaccinating their own children. Joining me today are two NFID leaders and trusted experts, Medical Director Dr. Bob Hopkins and Dr. Flor Munoz, to talk about back-to-school immunization. Thanks so much for joining me, Bob and Flor.
Happy to be here, Marla.
Thank you for the invitation. Happy to be here.
Bob, as parents, we certainly know that back-to-school time can be hectic. So why is it so important to make sure that children are up to date on all recommended vaccines this time of year?
Children are wonderful, and they're our future. Our schools are the place for children to learn, to grow, and to develop knowledge and social skills. But one downside is that children in close contact with each other easily pass a number of infectious diseases like influenza, measles, or whooping cough to each other, to the adults in the schools, and to their family members when they come home. Vaccines, immunization, is our best opportunity to prevent many of these important infectious diseases in our children and in our communities at large.
Flor, it's interesting. Many schools today require children to be vaccinated against certain diseases, some of which are rare in the U.S. So can you explain why children need to be vaccinated now against diseases that are no longer common here?
Yes, thank you. Schools are a place where children of different ages interact and very closely together for a long period of time. They're also very close to adults. And certainly, we know that there have been a number of opportunities in schools for transmission of a number of infections. So traditionally, schools require vaccines for some of these diseases so that we can prevent and control a little bit better the possibilities of transmission. The requirement is based on not just the individual protection for those who want to prevent infections, but also to try to minimize any effects of these highly transmissible diseases. And some of them we've been very successful in controlling. We think that they might be gone, but the reality is that some of these infections are still here, and they happen to have outbreaks every once in a while, depending on, again, how many people are protected and in a particular place like schools or other settings where people congregate. We have forgotten some of these diseases until we see some of these outbreaks. We have seen, for example, after the pandemic, a high number of cases of some of the vaccine-preventable diseases, such as whooping cough, measles, and certainly we have seen a high number of respiratory infections like those caused by the flu or RSV, which is another important virus that happens during the winter season. Certainly COVID is also still here with us. So these diseases are not completely gone, and they will not be because they cannot be eradicated completely like some of the diseases like smallpox was in the past.
We often hear that vaccines are victims of their own success, so I think that's clear. Bob, I'm going to shift gears a little and ask, what are some of the most common questions or concerns you hear from parents about childhood vaccines, and how do you typically answer them?
The first one I hear is directly related to what Flor just said. Why do you give MMR or polio vaccine when these diseases are not existing in the United States? And I tell them that we give these vaccines to reduce the risk for them reemerging in our own communities and causing preventable diseases, disability, and even death. We've seen this with measles in the United States this year. I'm also commonly asked why we need to vaccinate children against HPV. And I respond that this virus is responsible for thousands of cases of cancer annually. Giving this vaccine reduces the risk that your child will develop an HPV-related cancer. And then the other most common one I get is vaccine side effects, common questions around safety. And I talk about the safety data we have to date, the thousands of studies that have been done showing that our current vaccines are safe, and the ongoing monitoring of safety that we do for vaccines once they're out and being used in our communities. Along with that, we talk about common reactogenicity, the fever, the fussiness that often happens with vaccination, why this occurs, the stimulation of our immune system, how it's expected, and how to respond to those symptoms, and that there are not common serious safety concerns with the vaccines that we give our children.
As a follow-up, Flora, I know we hear it all the time. So the question is really, how do we know that vaccines are safe for healthy children?
Let me first start by saying that it is very important to ask questions. It's very important for parents to seek the information that they need to be comfortable and informed when they plan on vaccinating their children. I, as a mother, would want to know what my child is receiving and the reasons for that. It is true that we have more vaccines, and every time we come up with newer vaccines, I hear that the vaccine might be too new and maybe you don't want to receive it yet until others do. Or is the vaccine safe? Do we know enough about the vaccine to make sure that it's safe? And what I would like to emphasize is that today we have much safer vaccines than the vaccines that myself or others have received in the past. This is because we have technology in place that allows for these vaccines to be prepared in a way that is very targeted to the disease that we're trying to prevent. And also because we do have important pathways before and after a vaccine is approved and available to us in the clinics to ensure that these vaccines are effective and that they are safe. No vaccine is going to be available to us unless it has gone through a very strict regulatory process that includes clinical trials in the population that we need to give the vaccine to, and also the monitoring system in place after the vaccine is introduced to continue assuring that it's safe. The fact that we have a potential threat in the diseases that are reemerging, especially after the pandemic, that are vaccine preventable, is actually something that increases the potential risk of the disease compared to any perceived or potential risk of a vaccine that has gone through that process. And we know that the best way to have protection against these diseases that could be potentially serious and have complications in some people, especially children, is through vaccination. That is the best method we have in our hands right now for prevention of these diseases and complications. We are protecting our children, but we also are protecting those around us. So it's a family, it could be at the school community, it could be the community at large that is eventually being protected because we need a certain number of the population to be protected to be able to prevent these outbreaks.
It's overwhelming at times how much information is out there and available now, and certainly not all of it is accurate. So, Bob, how can parents best tell what information is reliable and accurate?
First, I would encourage parents to talk to their pediatricians, talk to the family physician, talk to other members of the child's healthcare team. That's a group of professionals that know you, that know your family, that know your child. They can give you best advice based on your individual characteristics and bring these vaccines into that discussion and how they apply to you. You get the personalized recommendation that way. If you're looking for an outside source, NFID has a number of useful resources about vaccines and vaccine-preventable diseases on our website, nfid.org. There are a number of other organizations, but that may be two great places to start. And again, I have to agree with Flora completely. Asking questions is good. If you don't ask questions, if you worry about something without asking questions, that really puts you at a greater risk than anything else we do. Ask questions, but ask them from reliable people that care about you.
Great advice, as always. I'll ask each of you if there are any other closing thoughts or advice that you'd like to share.
We all want the best for their children. The parents do. Your healthcare provider does. Everyone who is involved in prevention of infectious diseases is looking at what is best for our children. And there is a lot of information out there. Unfortunately, some of it is misinformation. Some of it is inadequate or incorrect information. And that has resulted in losing a little bit of ground in terms of our vaccine coverage. We are in a place right now after the COVID pandemic where we are at risk of getting exposed and getting infected with diseases that we can prevent through vaccination. We have the tools, we have the information, we have the resources. And yes, trust is an important piece. One thing that I don't like to see as a pediatric infectious disease doctor is a child in the hospital with complications from a disease that could have been prevented, especially when the parent might not have had the advice or the opportunity to have these vaccines available for their child. We are in a different time where we have a higher risk for some of these diseases, yet we have the opportunity very much at our hands to prevent them. And it's important to do.
I'm going to put on my historic hat a little bit. I've practiced medicine and pediatrics for over 35 years now. I've seen Haemophilus influenza meningitis. I've seen measles and mumps. I've seen a number of other vaccine-preventable infections through the course of my career here in the United States. Fortunately, I saw most of these infections early in my career, and they've become less frequent as effective vaccines have been developed and children more effectively vaccinated in our communities. My wife and I assured that our children were vaccinated on time and against all recommended diseases. I would love to see every child have that same vaccine prevention we have given to our children. Vaccines save lives, and vaccines make adults.
So thanks to both of you for your valuable insights, and thank you all for tuning in to Contagious Chronicles. If you have a burning question for an NFID expert, please submit it via the online form at nfid.org/contact. Your question may just show up in a future episode of Contagious Chronicles.